Now, case one, if you see, this is a 20 years male studying in first year engineering, presented with complaints of sounds in abdomen. He said that, there are sounds, rumbling sounds in abdomen. They are so loud that everyone can hear. That is what he was saying. And he's sitting in front of me and he's asking me, doctor, you can also hear these sounds, right? So he was like that. And he had frequent urge to stools since 8 months. Started after an acute gastroenteritis. Some time back, he had an acute gastroenteritis. So he says, after that, it is always there with me. So because of this, he avoids going to college with fear that abdomen sounds will be heard by others, and did not go to his midterm exams as he feels embarrassed that he has to frequently go to pass stool, and he feels that during the exams, if I get up and go, teacher will doubt me of malpractice. So he did not go to exams also. Parents say that they have visited all specialists, they have gone to all gastroenterologists, and they have done the colonoscopy as well. And all the reports are showing that it is normal. And also they visited psychiatrist, and psychiatrist has diagnosed it as hypochondriasis. But patient denies that he has any mental problem. He says that everyone keeps saying that my problem is in the mind, but no, my problem is in my abdomen. He's denying, he's not accepting that it is his mind that is affected and not his body. And the patient, loudly tries to voice and say that I am fine by my mind, but only my abdomen is affected. Okay, so if you see here, first there was a gastroenteritis attack, and after that he feels all these things, right? So first the now to say the corporeal body or the body is affected, and now the mind is affected. So he feels that sounds are heard by everyone. He feels embarrassed going there. So now in such cases, how are you going to manage such cases? So in such cases, what we have to do is, first we have to take whatever the corporeal disease was present, the gastroenteritis part or the symptoms that are related to that gastroenteritis part. So those symptoms are to be considered by taking the past history or even by talking to his relatives. So you collect that symptoms, and next present whatever the mind is affected. Now, because of this, how he is, feeling, how he's thinking, and how he's behaving. So take the present mental symptoms and you make a totality, and with this totality you'll have to prescribe the similar remedy. Okay, so now I have done the totality here. If you see the corporeal symptoms, what he had is pain abdomen, frequent urge for stools, and sounds in abdomen, so abdomen rumbling. Now present mental malady, if you see, he has the fear opinion of others. He feels that they're going to listen to my sound and they may say something to me. Or he does not go to college because he is having the fear that he's going to be observed because of that sounds, and he feels embarrassed because of all those things. And when he goes to exam hall, he feels that the teacher might suspect him for the malpractice. So he has fear of reproach and hypochondriasis. Okay, this is the present mental malady that he's having. So putting all this corporeal and present mental maladies, the remedy that was prescribed to this patient is ambragresia, one name, which was given twice a day for 3 days. And it was followed by placebo or SL 3 times for 15 days. Now, this patient, yes, he came for regular follow-ups. The patient is feeling better. Now, though the rumbling sounds, he says that they are still there. But what I have observed is that he goes to college regularly. Nowadays, he's not, bunking his college, or he's not staying at home, being at home. And because of this, symptoms, this corporeal symptoms, or the frequent urge to stool, he was not eating food properly, or he was very, choosy about what to eat, what not to eat. But now he is able to eat all the food, and he is able to attend his classes regularly. Okay, so this is the first type, that is the somato-psychic type. Now, this is another case wherein here this is a female patient. She's aged 20 years, presented with complaints of lack of interest in everything. She was always locked in her room, not coming out, not talking to even the home people, and not talking to anyone, not doing any work. She is very sluggish, no desire to grow. I asked her, why don't you do any work? She said, I don't feel like doing any work, but sometimes I feel they may feel something about me, so I will do some work. But since I do very slowly, they don't give me any work. So she's very so sluggish. and she does not feel like, grooming, even the normal grooming, combing hair, I mean, wearing, good clothes, even that she's unable to do. And when she's sitting in front of me, she's constantly weeping. She's not even able to narrate the complaints. She's going on weeping. So some days she does not eat food at all. So she has no interest to eat food. Or some days she eats a lot. And then later on, she starts feeling sad. I ate so much food. That is binge eating. So she binge eats or she does not eat food at all. She has insomnia. She has body aches and irregular menses. For the irregular menses, investigations, I mean, USG and hormonal analysis were done. There is no abnormality in any of the parameters. All all complaints were present since 2 years, and she was diagnosed by a psychiatrist as borderline depression. So on observation, when I was asking her questions, she was answering very late, or, she used to take some time to reply, or even if she's replying very slowly, I could hardly hear it. And in just 1 or 2 words, she was replying. And she's a tall lady, fair and well built, and she's weeping continuously. And she had come with her a friend. Her friend was saying that she's married since 4 years, and she's not in good terms with her husband, and she has come out of the house, and husband does not want her to come back. Now she's staying in her sister's house, sometimes in her sister's house and sometimes in mother's house. And she feels that I'm a burden on them, that both of them. She feels that she's very slow and does not show interest in any activity. So her sister and mother are unhappy with her, that she does not show interest in any activity. Right. So now if you see here, what is happening now, because, she has a problem in her family. I mean, husband does not love her, does not show any affections to her, and it has been there since 4 years. Right. So since 4 years that she's married, and husband does not even, show any kind of, warmth towards her, or any kind of affection towards her, and he does not want her to come back. So this is since her marriage. She's not happy with her marriage. So this is going on. So because of which, right now she has started. Now the husband has said, you go out of the house. I mean, you don't come back now. You go and don't come back now. So because of which, now she has lost interest in everything. So if you see here, what has happened is, first, because of her, continuous sadness or depression, so she has landed into some kind of somatic problems like irregular menses or insomnia and all those things. Okay, but basically it is because of her mind, which is constantly sad, constantly disappointed. So because of which she has landed into mental disorder. So this is psychosomatic type. Now, how do we manage such cases? So what Hahnemann has to say about this, he says such cases will require counseling. You see, this is mentioned where in Organon of Medicine in aphorism 225. So what I'm trying to say is, this is in the 18th century that he has written, right? So he says that this patient requires counseling. This patient requires friendly advices. This patient requires display of confidence. Diet and regimen has to be maintained. So first, counseling has to be done. You have to, sit, talk to the patient, call her frequently, become a very good friend to her. And, you keep boosting her morale, you keep boosting her confidence, and make sure that you make some arrangement in her lifestyle wherein her esteem is boosted, wherein she's motivated to come out, right? So you have to do all this. Okay. Along with this, he's saying that you have to make a totality and give a constitutional medicine. Now, here basically the totality, what we do is the continuous mental state she was living in for that last 4 years, plus her basic traits, what are her premorbid traits. You take all those things, and presently with what mental state she is in and what physical complaint she is having. So with all these things, you have to make a totality. Right? So if you take the totality of symptoms, so there is ailments from love, disappointment, she's disinclined to talk. So she's having indifference society too. She's having indifference to her personal appearances. She's sluggish, bulimia alternating with refusal to eat, menses irregular, body aches. And if you see her premorbid trait, she's always slow, indecisive, and a dependent type of person. Okay. So with all this totality, the medicine prescribed was Calcarea Carb 1M once a day for 3 days, followed by SL, that is placebo, for 3 times for 15 days. Okay. Along with this, repeated sessions of counseling was given, give a calendar to the patient, and she has to, you give the lifestyle, what time she has to get up, what time she has to eat her food. You give everything to her, and you give a calendar as well, so that end of the day she has to go on ticking whether she has done all those things, right? So this will keep motivating her to do whatever you want her to do. CBT, CBT, yeah, now we say, cognitive behavioral therapy, but Hahnemann has given these things long back only. He says that we have to change their behavior, we have to change the way they feel and the way they talk, the way they think. Okay, here if you see the way, what she thinks is that nobody likes me. Okay, nobody wants me. That is what she thinks. And what she feels is very low esteem, low self-confidence. She feels sad, right? So that is a feeling. And what she behaves is by not coming out of the home, being with herself all the time. Okay. So you try to change the way she thinks, you try to change the way she feels. So automatically her behavior is also will change. Along with that, you give diet counseling as well. Right. So with all these things, now this lady, with all counseling and friendly advices, after all those things, now I have, suggested her. Now she's taking classes in kindergarten classes, so she's going regularly for those classes. So hopefully after the classes, she will join as a teacher as well there. So she's able, every day she's going for walk. Now she's having friends in her neighborhood. So she's living with her sister now because her parents are old. So she does not want to trouble them. So she's living with her sister. So she is helping her sister goes to work. So she is, equally helping her sister in all the household activities. She's able to make friends outside. She goes for regular walks. Her weight also has, reduced now because she's, working on it. And yeah, she's going for the kindergarten classes, and hopefully I hope that she will become a teacher there as well. Right. So this is a case of psychosomatic type. Okay, let's go to the next case. This is a 18 years male studying in PUC second year, presented with complaints of apprehension, palpitation, tremors since 2 days, unable to sleep, wakes up with anxiety, dream. And why he wakes up, repeatedly he's getting dreams of being murdered. He gets up with apprehension and tremors. So all this started 2 days back when he was writing a test. In middle of the test, he started getting palpitations and tremors, and the teacher observed that he's not well, and she called her parents, and parents came in, took the patient home. Same problem had happened 2 months back. Similar episode had happened 2 months back in his tuition class, where he was asked for a presentation. Not a big presentation, though. He had to address in the classroom about something. So there again, he had the similar attacks. That time the parents had taken him to the physician, and the physician had given him anti-anxiety medicines. Okay. Now here, very important, if you see dreams of being murdered, you can see this. Okay. Now this is the mental disease, which Hahnemann says is due to mental disease due to exciting cause. Now, what is the exciting cause? If you see here, it is that apprehension when writing the test, or apprehension when he's giving a presentation, right? So that is triggering him, or that is exciting him, and he's coming out with palpitations and tremors, and then he's not able to sleep. And at night, whenever he sleeps, he's getting bad dreams, and he's getting up with dreams. So that is the exciting cause. So now, such cases, how it has to be managed. What Hahnemann says is, in such cases, you have to take a complete picture, like how you treat the acute cases. We have a different guidelines to treat acute cases, right? So in the similar guidelines, we have to treat this mental disease due to exciting cause, the cross-sectional symptoms or expressions of the patient has to be taken. Right now what the patient is feeling, or right now what are his physical symptoms. So these are to be collected, and a totality has to be framed, and a medicine has to be prescribed. Okay, if you see here, so right now what is happening, it is all because of the fright, right? Ailments from fright, and he's having anxiety waking on. As soon as he gets up, he's having anxiety, and he dreams murdered being, right? And Generally what is happening, he's having tremors all over. They are external tremors and they are because of anxiety. Now with this totality, the medicine prescribed was lachesis. Okay, so lachesis 1 ml was given 3 times for 3 days. Since it's very acute, so repeated 3 times for 3 days and followed by SL for 5 days. Okay, after 5 days, because it's a very acute one, so don't give for 15 days or 1 month. Call him back soon. Okay, so once all the symptoms are settled, then once again you have to take the case, and then like the case taking, what we do for the chronic case, you take a detailed case and then you prescribe the constitutional medicine in the follow-up once these symptoms have come down. Okay, so this is about mental disease due to anxiety cause. Okay, now coming to the last type. Okay, now this case you can see it's 42 years male patient working in a private company, presented with complaints of lethargy, lack of pleasure, low motivation, feeling of sadness, without any cause also he starts feeling sad and he feels like crying though, and he's not able to cry though. And he has no pleasure in anything. He's raised in a joint family. Mother was constantly dominated by uncle and father. History of depression episodes during his adolescence. When he was 16 to 18 years, that time he lost his mother. He says that he lost his mother because she was sad. And then he says that no, she had brain hemorrhage. Okay, so exactly I do not know, but yes, he lost his mother when he was 16 to 18 years, and at that time he had frequent episodes of depression, and he had taken treatment as well during that time. So patient is under depression for a long time, and he was under treatment for depression for 2 years during that time. He's a known case of chronic renal failure. His creatinine levels and all went very high. His blood pressure went up to 180 by 120 and all that. And he is on treatment for chronic. He's on antihypertensive treatment. And he's also known case of hypothyroidism since 12 years. He has history of long working hours and stress at office. And he has constant criticism from father even now. So father always considers him as a loser. Now, father feels that sister is always, father always appreciates his sister. So the patient feels his sister is always appreciated by father. After marriage, also father continued to criticize him. So wife was not liking this because husband is being constantly criticized by father-in-law. So she was not liking. So she got into arguments between, and there used to be arguments between his wife and his father. And this he was not able to bear. The patient was not able to see his wife and father arguing all the time, which used to happen in his childhood also, where his father and uncle used to always dominate on his mother. So there used to be frequent arguments then also. So he's very sensitive person who does not like quarreling and discords in the family. So because of all these things, wife got separated with her son for 2 years. Then patient feels if mother was there, everything would have been fine. He misses his mother very much. Patient wants to keep his father happy but not succeeding. So he feels that he is worthless, and he feels that if his health is good, everything can happen. So he feels his health is not supporting him. So feels everybody looks at him like a failure. So here, if you see, we do not know whether the mental illness was first or the corporeal illness was first, or later again there was mental illness. If you see, depression was there when he lost his mother, and then there was chronic renal failures, hypothyroidism, and all those things. And then again, now there is depression and all those things, right? So here we do not know whether the mind disease has started first or the physical disease has started first, right? So this we put it under mental diseases of doubtful origin, right? So aphorism, Hahnemann groups such kind of disease under mental diseases of doubtful origin. Okay. Now, what Hahnemann says can be done for such diseases? What he says is we have to give sensible, friendly exhortations, that is counseling, and sensible advices to him. And at the same time, so you can see during the course of the treatment, his physical symptoms can become exaggerated, or his mental symptoms can become exaggerated. So along with friendly advices, counseling, and all those things, he says that and totality has to be formed, and constitutional remedy has to be given to the patient. Okay, so in this case, what we do is you take the totality of symptoms. So what I took here is ailments from discords, ailments from domination, forsaken feeling by his parents and wife, and he has an orphanage feeling, and he has kidney complaints and hypothyroidism. Okay, so with all these things, medicine given was magnesium muraticum 1 ml, 1 dose for 3 days, and followed by SL 3 times for 15 days. Along with that, counseling was done again, understanding his behavior, wherein he avoids his father, does not intimate with the wife, and he's socially withdrawn. Why? Because he feels sad, he feels anger on his father, he feels sad, he feels worthless. Okay, and what are the thoughts? The thoughts he gets is that nobody loves me and I'm alone. Okay, so because of this, he avoids them, right? So you try to understand this and you try to change that, change his thoughts, change his feelings and behavior. Along with that, magnesium muraticum. Okay, so this patient also, now his creatinine levels, they are all fine, though his hypothyroidism is also, I mean, he's also on thyronorm, and for depression right now, he's not taking any medicines for depression. He's purely on only homeopathic medicines, and he's doing good. Okay, now this is how Hahnemann has given his guidelines to treat the mental disorders. Okay, so with all these cases, I would, conclude by saying that physiotherapy has always been a part of homeopathic management of mental disease right from Hahnemann days. Okay, so we have been doing physiotherapy since then, and it is all written in our organon of medicine. So following homeopathic guidelines by organon of medicine will definitely heal most of the psychological problems, right? So more than all these things, you give any kind of medicines, I would always say that, always, as a human being, or whatever advice you can give to your patients, you always, guide them towards happiness. You give them the way to happiness. If they are happy in any moment, if any, at that moment, if they're happy with whatever they are doing, with whatever they are, I don't think they can land up in any kind of mental illness. Okay, so as physicians, I think we should always guide our patients to mental well-being and make sure that they live in happiness all the time and most of the time. Okay, so that they do not land up into any kind of illness.